All right, this is the os coccyx bone or innominate bone. This is a right innominate. And now I'm going to go through the bony landmarks by first starting with the greater sciatic notch. This is this divot in the bone right here. There are a bunch of little divots and curves all around the innominate, but the greater sciatic notch is the biggest and most obvious, so this is very easy to find on the innominate. With the greater sciatic notch, you're going to be able to find left and right and posterior and anterior. You can use this sort of telephone method that Dr. Afton showed in class. And you can also find posterior, anterior. You can also find the ischium and the pubis, all just with the greater sciatic notch. So make sure that you can find this, greater sciatic notch. Now, greater sciatic notch is on the posterior aspect of the innominate, Excuse me. So then that would mean that these are the posterior spines, these are the anterior spines. So then this is how it's going to go. Anterior, superior iliac spine, anterior, inferior iliac spine, posterior, superior iliac spine, and posterior, inferior iliac spine. You have to remember that greater sciatic notch is on the posterior aspect. So these are the posterior spines. So the opposite is the anterior spines. Then you can find the acetabulum. The acetabulum is the big socket. And on the outer lip of the acetabulum going towards the obturator foramen, there's going to be this little break in the lip. This is going to be the acetabular notch. The ischial spine, you also find that by finding greater sciatic notch. Once you found that, and this little bump or protuberance, that's going to be the ischial spine. Then you're going to have the lesser sciatic notch. So then it goes greater sciatic notch, then this little bump, which is the ischial spine, and then lesser sciatic notch. Then you're going to find ischial tuberosity, which is this rough spot right here. The way that I like to find this is to once again find greater sciatic notch, ischial spine, and then lesser sciatic notch. And then the rough part is going to be right after the lesser sciatic notch. You can tell that this is the ischium and not the pubis because the ischial spine is right next to it. So this area of the bone is ischium, so then the opposite side would be pubis. So that would make this the pubic tubercle. Notice that the greater sciatic notch and the ischial spine are on the opposite side of the pubis. So pubic tubercle is on the opposite side of greater sciatic notch. Then we have the obturator foramen. That's the big O hole in the middle. And then iliac fossa and articular surface for sacrum. So on the ilium, you're going to have the sort of flat and smooth side, and then there's going to be a side with a very rough patch. This is going to be your articular surface for sacrum, and right next to that, this divot is the iliac fossa. Okay, patella. This is a right patella. We're first gonna have the apex. That's this sort of triangle-shaped tip on the tip of the apex. And then on the other side, these flat parts are just gonna be articular surface for femoral condyles. Okay, now we have the tibia. This is a left tibia. I'm gonna start over here. I like to orient myself with the medial malleolus. This is gonna be on the medial aspect of the left leg. And that sets me up to define these. These are the condyles of the tibia that contact with the condyles of the femur. So that's gonna make this the medial condyle because it's on the side of the medial malleolus. This is the lateral condyle right here, this surface right there. Then in between is the intercondylar eminence. This is a protrusion that sits above the condyles and in between them, so the intercondylar eminence. And then the tibial tuberosity is this bump and rough spot right underneath the condyles. And the anterior crest is going to be right underneath the tibial tuberosity. This is the anterior side of the tibia, so underneath it, that ridge. And then medial malleolus, already pointed out. And the soleal or popliteal line is going to be on the posterior aspect, so opposite of tibial tuberosity. That's going to be this, it's faint on this model, but right about here, this line of rough patches is going to be the soleal or popliteal line. Now the articular surface for tibia is going to be opposite of the medial malleolus, so on the distal part of the tibia, opposite of medial malleolus, so on the lateral side of the tibia is going to be the articular surface for fibula. For tendons, on the medial malleolus, on the sort of posterior aspect of the medial malleolus, you're going to find a little tiny groove that tendons will run through. And then finally, you just have the body of the tibia. So here we have foot, and then we have, and this is going to be similar to the hand. So we have tarsal bones, metatarsals, and then phalanges. There are 7 tarsal bones on the foot. There's going to be calcaneus, which is your heel bone. It's this massive bone. Then the talus, which kind of sits on top of the calcaneus. Then the navicular, cuboid, and then cuneiforms. So first, second, third cuneiforms, metatarsals, and then the phalanges, which are defined in the same way as on the hand. So this would be the second proximal phalanx. Now, sometimes it's confusing to differentiate the tarsal bones. So this is calcaneus, talus, navicular, cuboid, and then cuneiforms. Sometimes it's hard to differentiate them. And navicular sometimes doesn't really even look like a boat, but if you look at it from here, this is sort of the bottom of the boat, and then it kind of has this curved top. If you can see it, that's the navicular. Now for left and right of all the bones, for foot, find the big toe, which is the one with the 2 phalanges instead of 3 phalanges, and then kind of match it up to your own foot and your own heel, and this is going to have to be a left foot if the big toe is medial and the small toe is lateral. For the fibula, find the lateral malleolus, and then put your thumb not on the side of the malleolar fossa, but put it on the other side on the sort of rough patch, and then the styloid process on the lateral malleolus is going to point you to the side. So this is going to be a left fibula. For the patella, put the patella on its articular surface and then point the apex away from you, and then it's going to sit naturally on the side that it is. So then this will be a right patella because the apex is pointed away and it's sitting on its right side. The innominate, you can use the telephone trick that Athman taught you, or what I like to do is put 2 fingers in the obturator and look at the iliac fossa and the articular surface for sacrum. Now the posterior spines, which is on this side, same side as greater sciatic notch, are going to point towards the side it is. So this is going to be a right innominate. Now for the femur, grab it by the head and point the condyles away from you. The condyles are going to point towards the side that the bone is. So this is a left femur. For tibia, palm the intercondylar eminence, so put that on your palm, and then look at the posterior aspect of the tibia. And then the medial malleolus is going to point towards the side that it is. So this is a left tibia.